Hi everyone, this is Dr. Ginger Garner here. I've been doing yoga for a long time, 30 years now, and my entire focus has always been, from my personal experience, but also as a doctor of physical therapy, it's always been joint preservation. It's not, it being yoga is not about flexibility. It's never been or never should have been about flexibility. And I don't even use the word stretch as a result of all of the misinformation out there that's about circulated about yoga. Lots of crazy things are done in the name of yoga. So I've been using yoga for 25, nearly 25 years with my patients. I started a program that now I've certified healthcare providers all over the globe for the last 20 years and how to use yoga safely in a trauma-informed and sensitive way that really tackles chronic pain effectively and chronic disease, as well as prevents it. So that's what this playlist is about. I hope you will enjoy that. And if you have suggestions for videos you'd like to see on how do I make this pose safe for back pain, hip pain, shoulder pain, etc., please drop it in the comments. Would love to hear from you. And for all of the potential referral sources out there, I totally understand as a fellow doc why you don't recommend yoga for your surgical patients. Why would you? Because of all of the emphasis on flexibility out there. So I just want to tell you, if you're a referral source watching this, I do not use yoga for flexibility, and I do not train anyone to do that. So if you can come across a therapist who I have trained in medical therapeutic yoga, I wrote the book titled Medical Therapeutic Yoga, then that is your best bet for referring patients to, because they are going to use yoga in a very safe and effective and evidence-based way, because the mindfulness component of yoga does make it more effective than physical therapy and exercise alone. All right, enjoy this playlist.